Hey guys, welcome back to the channel. Tony here. Today I have something very special prepared for you. So here is my friend Sudi.
Hey fellas, how you going?
So Sudi is actually studying medicine at the University of Sydney, and I flew him down here just for this very special interview to give you guys some insights into what studying medicine at USyd is like. So tell us a bit about yourself.
Yep. So I'm Sudarshan. I'm originally from Sydney. I did high school in Sydney and then came to Melbourne for 3 years to do biomed. So I always wanted to do med even from high school. So I decided to do the interviews at both Melbourne and Sydney. Had a really tough time deciding between the two of them, but ended up picking Sydney. So now I'm a first year med student at USyd.
Alright, so Sudi, what made you choose USyd over Unimelb?
That's a really good question, Tony. So it took me a while to decide actually, because obviously I did 3 years in biomed, had a lot of friends here in Melbourne, and would be really sad to leave them all behind. But the main thing that sort of made me want to choose USyd was that I could live with my family again, because I knew that med was going to be pretty stressful, and I thought it'd be a really good idea to have my family there to sort of support me through it. And apart from that, I guess longer term I wanted to work in Sydney, like settle down in Sydney longer term, and I guess it would just make it easier if I did med school at Sydney. But apart from that, like stuff like the way the course was organised or like the quality of the teaching, it's all pretty similar, so that didn't really sort of factor into my decision, I reckon.
So Sudi, I know your decision in choosing between USyd and Unimelb was largely influenced by the fact that you're from Sydney. So let's just say that you're not from Sydney, you're from some other state. How would that have influenced your decision in choosing between the two?
So I think the first thing that you should consider is med school is 4 years, and after med school there's a strong chance you're going to be in the same state and more likely city as well, because of the way the whole like training pathways and stuff work. So the number one thing you'd want is to pick a city in which you like and you're happy in. And so I would recommend, if you're not from Sydney or Melbourne, definitely spend a couple of days in both cities and see how you find it. From my personal experience in terms of like pros and cons for Sydney and Melbourne, I would say Sydney definitely has better weather, because obviously Melbourne weather, like at the best of times, can be pretty trash. And the beaches in Sydney, like I wouldn't even call the Melbourne beaches, to be honest.
Hello darkness, my old friend.
Sydney definitely has the edge in terms of beaches. But I think the big one that students would be interested in would be like accommodation, for example. And I reckon Melbourne definitely has like the upper hand there. So accommodation is probably cheaper in Melbourne, and you probably got more options close to uni as well. And I reckon definitely getting around in terms of public transport with trams and stuff at Melbourne, it's a lot easier as well. Once you've got location sorted, because I reckon that should be like the number one thing that you decide in, that should influence your decision, then you can start looking at like what are the differences between the course in Sydney and Melbourne. And I guess the number one difference is like the amount of time, or the way it's organized in terms of preclinical and clinical. So in all med schools you have a certain amount of years that you spend doing preclinical, which is where you learn like the basic sciences that underpin medicine, so like anatomy, biochem, physiology, that sort of stuff. And in Melbourne they condense that all down to 1 year. So first year can be pretty stressful from what I've heard, but then after that you can spend year 2 and 3 full-time in clinic, so you get really early clinical exposure as a full-time clinical student. It's slightly different in Sydney, where preclinical is 2 years, so you spend 2 years learning anatomy, physiology, that sort of stuff, and that's got its advantages. You can go like deeper into all the various like sciences that are basically form the basis of medicine. And you also get once a week in the hospital that you're allocated to, so that's also good as well. But the problem is you're going to have to wait until third year before you're a full-time student. And so it really depends, like do you need 2 years to properly like learn all the science before going into the hospitals? Or are you the sort of person that prefers like hands-on learning and you want to get into the hospital really early, starting from year 2? I guess that would probably be the biggest difference between Sydney and Melbourne's like MD courses. I reckon like in terms of teaching standards and like the quality of resource and all that, they're pretty similar between Sydney and Melbourne. So definitely location and which course structure suits you would be what I was thinking of if I wasn't from Sydney or Melbourne.
Alright, that was very insightful, thank you. Alright, so Sudi, I know that for Unimelb and USyd, for the med school application, the two processes are actually quite different. So can you tell us a bit more about that?
Yeah, sure. There's quite a few differences in the admissions whole process. To start off with, USyd is not actually, you don't apply to it via GEMSAS, and everything in USyd is a couple of months before what happens in GEMSAS. So you submit your initial application a few months before, you see your interviews in July, and you actually get your med offers in late August, early September, which is, I think GEMSAS is around November, something like that. So it's a couple months earlier.
And what type of documents do you provide when you do application?
Yeah, so just pretty much just the standard stuff. Same thing as GEMSAS. So you got to give your academic transcript, obviously, and then just proof of citizenship, ID stuff. Yeah, that's pretty much it.
Right.
Mm-hmm.
Okay. Well, so kind of more technical in terms of the interviews. So I know Melbourne Uni has a kind of 50% interview, 25% GAMSAT, 25% GPA split.
Mm-hmm.
What's that like for USyd?
Yeah. So it's pretty different for USyd. So obviously with Melbourne, the higher your GPA, the better your chances are of getting both an interview offer and an actual med offer as well. But with USyd, what they have is a GPA hurdle. So as long as your GPA is above 5, they don't really consider GPA after that. So interview offers are given out just based on GAMSAT scores. And so that could push the GAMSAT cutoffs a bit higher for interviews, but it's generally around 69, high 60s, maybe 70 if it's a particularly competitive year. And then the final med offer is 50% interview, 50% GAMSAT. So GPA pretty much doesn't really matter for USyd as long as you get above 5. Mm-hmm. And in terms of the actual interview itself, they're both MMIs, obviously, but Melbourne.
So what's an MMI?
An MMI, true, very, very good question. It stands for multiple mini interview. So instead of your traditional panel interview where you just go into a room with a couple of people and talk for an hour, the way MMI works is you've got any number of stations going from 5 to 10, and you go into a room and you spend only about 5 to 10 minutes in each room, and each room has a particular theme that you have to focus on. So there might be a question outside the door before you go in, and you basically get the chance to talk to a lot of different people in that process, make a lot of different first impressions. So it's just sort of like a traditional interview but split across a lot of mini stations. Yeah. And with Melbourne, they both use MMI. With Melbourne, there's something like 8 or 9 stations, and the time you spend in each station is a bit shorter. But the biggest difference in the MMI is that Melbourne tends to ask a bit more personal questions. They want to get to know you a bit more, what you've done, what your achievements are, what are some of the things that you've participated in, that sort of thing. And they do also want you to show that you've done a bit of reading on stuff like public health and med policies, and a bit of stuff on ethics and legal implications of medical practice. Whereas with USyd, the way it works is you've only got 5 stations and you spend 7 minutes in each one, and it's a lot more focused on the ethics surrounding medicine and your decision making skills, and how you go about thinking your way through a scenario. So they'll give you a scenario that's very ethically oriented, it could be something about consent, or it could be something to do with beneficence, which means whether what you're doing as a doctor is actually doing good for the patient, or whether you have to consider a lot of different things ethical implications in USyd.
Right. So can you give us an example of one such scenario that they asked you?
Yeah, and the other thing to note with the scenarios is that it's not always medical at USyd. It could be anything. So we were given one of the practice scenarios that we went through was you're working in a cafe with someone, and you notice that your co-worker is stealing money from the till. They have 4 or 5 questions from that stem that they ask you. So what do you do if this is your friend? How would you talk to them? How would you approach the situation? What are the ethical ramifications of this scenario? That sort of questions. So yeah, you just got to work your way through. And the most important thing with USyd is not really the answer that you come to, but just demonstrating to them that you're thinking your way through all the different possibilities, looking at it from everyone's point of view. So that's the other thing they don't want you to be too judgmental. They want you to see things from other people's perspectives and show that you don't have a very one-track mind in how you look at these things. So yeah, that's just stuff to be aware of for the interview.
Alright guys, so on my channel I select the best of the best people for my interviews, and Sudi here, he actually topped USyd Med in first year. So Sudi, I know the the transition between undergrad and postgrad medicine can be, quite a big adjustment. And like for myself, I certainly struggled with finding kind of the right studying technique to deal with, the kind of information overload that you get in medicine. So what would your advice be to someone who is transitioning from undergrad to postgrad medicine?
I think there's a lot of different ways of going about it, and the most important thing is that you find what works for you. So like, don't get too carried away if someone tells you this like amazing technique that they found out and then you find it doesn't really work for you. So definitely spend maybe 2 or 3 weeks, if not longer, trying to figure out what works best for you, and then stick with that for the rest of the time. And it's definitely true that there's a lot of information that you have to take in. You'll have like heaps and heaps of lectures every week full of like content that you have to get through and memorize realistically in order to like answer the questions in the exams. And there's a lot of different ways of going about that. Me personally, I found it was really good to just flick through lecture slides at the beginning to try and get the big picture view before diving into like memorizing all the little details. And with the little details, the best thing you can do is active recall. So that could be a lot of different things. You can get your friends to test you on the details, like maybe make up questions based on learning objectives and try and answer it to your friends. You could use an app called Anki, which lets you make flashcards. So on the one side you could have a question, and on the other side you can have the answer, and that's a really good way of memorizing like tiny details that you get in the lectures. So yeah, definitely active recall is probably the best way to go. And the other thing that a lot of people talk about is spaced repetition as well. So with memorizing details, obviously you can memorize something today and then a couple of days later it's just going to be completely out of your brain. So you really need to be repeating a lot and spacing out those repeats to make sure it's all about long-term memory with med exams, because you can study something for one exam and then forget it, and the problem is basically every exam that you have in med school tests everything you've learnt up to that point. So it's all about long-term memory. And the final thing is, don't be afraid if you can't take in everything, because there's just a crazy amount of content. Like, no one's going to get 100% in an exam. You're not going to remember every single thing that they taught you in the lecture. So well, I mean,
97 I heard.
Only in the first exam. Only in the first exam. Right. So with subsequent exams, it's just like a constant amount of extra lectures that you add on, and so it's very, very hard to score really high grades. So just don't knock yourself too much if you're not remembering everything. That's what I would recommend. Yeah.
All right. Well,
very wise words, Sudi. We wish you the best of luck in your future USyd endeavors.
Best of luck to you as well here in Melbourne.
And what do you have to say to my to people who are watching this video?
You mean what do you mean? What I have to say? Oh, all right. So Tony's got an amazing channel going on here. Don't forget to like, comment, and subscribe for all the inside information on how to get into med. And best of luck with all of your applications.
All right. Thank you, guys. I'll see you guys very soon in the next video. This is Harris. He filmed the whole thing for us, and Harris here is actually a chancellor. And he is taking a gap year right now. So we did biomed in the same year level, and or after graduating, Harris decided to take a gap year. So kind of, what made you decide to take a gap year?
Well, to be honest, I wasn't thinking of taking a gap year first. I was pretty keen to start med after 3 years of biomed. I was quite keen to do more clinical work and stuff. But when I saw that they had the opportunity to take a gap year before med without affecting my offer at all, just pretty much delaying it 1 year. I thought that was a good opportunity for me because I've always loved traveling, and I knew that once med starts, obviously time is a bit not on my side for traveling and relaxing and going around the world. So I thought, why not? Not putting my offer at risk in any way. So I took a gap year to first also go back and see my family in Adelaide, spend a bit of time with them because I left straight away after high school. So that was the main reason. And second of all, also travel, do some volunteering. There's also, I quite want to do some volunteering in Southeast Asia and, just in medical field, I think, before going back to Melbourne and starting med refreshed and ready to study. It wasn't really I don't really want to do meds. It was more, this is probably the only opportunity I'll have to take a gap year and travel before, starting med, internship, and your registry, residency, which gets quite intense. So I thought it was probably the time to do it, and that was the reason. I mean, having an opportunity with the Chancellor Scholar Program allowing me to do that was definitely one of the main reasons that I took it. Yeah.
Well, thank you very much, Harris, for shooting the video for us and
worries,
for
guys.
doing this very quick Q&A. Well, Harris has an Instagram account, so make sure to follow him on Insta. I have plugged the link in the bio. And all right, cut.
Thanks, guys.